Good morning, everyone. Half a day. The Committee on Health, Land, Justice, and Culture is now called to order. Today's Thursday, July 25th, 2024, and the time is 8:35 a.m. In compliance with the Open Government Law, notices for this public hearing were published in the Guam Daily Post and posted to the Government of Guam Public Notice Portal on Wednesday, July 17 and Tuesday, July 23rd, 2024. Notice was also sent by email to all senators and all main media broadcasting outlets. This hearing is being live streamed on the Guam Legislature's YouTube channel. So I'm Therese. I'm the chairperson of the Committee on Health conducting this hearing. The only real rule I really want you to follow is please state your name before you testify, because we're transcribing these proceedings, and that way we'll be able to identify who's speaking at all times, and we'll begin. All right, so we're going to begin with the reappointment of Dr. Gregory Miller. If there's anyone here to testify on this appointment, please have a seat up front. Otherwise, Dr. Miller, please come. All right, now we have actually several agenda items today. We're going to hear the reappointment of Dr. Gregory J. Miller to serve as a member, the Chiropractic Representative on the Guam Board of Allied Health Examiners for 3 years. We also have the reappointment of Katherine Nicholas to serve as a member, the Nutritionist Clinical Dietitian Representative to the Guam Board of Allied Health Examiners for 3 years. We have a new appointment of Sungwook Steve S. Kim, MS, DPM, APM, to serve as a member, Podiatric Representative for the Guam Board of Allied Health Examiners for 3 years. We have the appointment of Velma R. Harper, DVM, to serve as a member of the Veterinary Medicine Representative for the Guam Board of Allied Health Examiners for a term of 3 years, to fill the seat of Dr. Paul Pomes, whose term has expired. And we have the appointment of Roselin Tiding Fong, OT, to serve as a member, Occupational Therapy Representative for the Guam Board of Allied Health Examiners for a term of 3 years. All right, and before we start, because all of these are appointments for the Guam Board of Allied Health Examiners, I just want to put on the record very quickly the powers of these board members on the Guam Board of Allied Health Examiners. The Guam Board of Allied Health Examiners includes acupuncture and oriental medicine. There are 13 on this list. I'd like to welcome Senator Terlaje. Welcome, Senator. Thank you for being here. So there are 13 specialties included on this board. One is acupuncture and oriental medicine, audiology, chiropractic, clinical psychology, licensed professional counselor, licensed mental health counselor, marriage and family therapist, clinical dietitian and nutritionist, occupational therapy, physical therapy, speech language pathology, respiratory therapy, and veterinary medicine. The board can also add other allied health professions upon recommendation to the governor. There are also 2 public members who are neither a practitioner of the healing arts or representative of a healthcare institution or insurance company. The terms are for 3 years for all of these members, and they shall have practiced in their respective disciplines for at least 5 consecutive years immediately preceding the appointment. They shall be citizens or permanent residents of the United States who have resided in Guam for at least 5 consecutive years immediately preceding the appointment. The board is authorized within the context of this act and the requirements of due process to have the following powers and responsibilities: to promulgate rules and regs, develop and adopt a budget, evaluate education and training of applicants, select and administer licensing examinations, evaluate previous professional performance of applicants, issue or deny initial licenses, approve or deny applications for license renewal, receive, review, and investigate reports and complaints received from law enforcement agencies, healthcare organizations, governmental agencies, insurers, and other entities having information pertinent to the professional performance of the licensee, to discipline licensees found in violation of the Allied Health Practice Act, to issue subpoenas, administer oaths, receive testimony, and conduct hearings, to institute actions in its own name and enjoin or to stop violators of the Allied Health Practice Act, to establish fees and charges to support the effective pursuit of its legal responsibilities, to expand the Allied Health licensing process to include other health professions not having separate board of examiners enacted by law, to contract consultants for special needs of the board in the investigation of complaints, monitoring of a licensed person in terms of violation, and other monitoring or investigation that requires specialized skills, which the board is unable to obtain from the services of other government agencies. Finally, to conduct board meetings. The rest of the statute talks about quorum, immunity of the board members, and communications. And all right, so we're going to proceed now. All right, are you anyone here to testify for Dr. Miller? Okay, you may proceed. Please.
The Guam Board of Allied Health Examiners. Our chairperson is currently off island, so I'm here representing the board. And I'm here today to support and endorse the confirmation of Dr. Gregory Miller to be a member of the board as the chiropractic representative. I've known Dr. Miller for many years. He served on this board for many years, and we welcome him back for his continuing service. Dr. Miller has served very distinguishedly over the years and has been the expertise of the chiropractic practice or discipline on the board. And so we welcome him back as he now fills a void that's been lacking for quite some time. Therefore, I strongly endorse and support him and recommend that the legislature confirm him as soon as possible. Thank you, Madam Speaker.
Mr. Pereira. Dr. Miller?
Good morning, Speaker Taitagui, Speaker Terlaje and Senator Taitagui. So my name is Dr. Gregory J. Miller. I'm a chiropractor. I'm now nearly 40 years of practice on Guam, 40 years of continuous practice in chiropractic. So I'm just going to go over a few brief bullet points, what's been going on in my opinion, which needs to be helped a lot for the Allied Health Board. The Allied Health Board, really, we need lawyers to represent us in prosecutions of illegal providers or complaints against our licensees. We have an assistant attorney general who guides us through our meetings and makes sure everything we do is legal. But ever since many years ago, Attorney General Barrett Anderson informed us they would no longer prosecute. They, meaning the Attorney General's office, would no longer prosecute for the boards. So when it comes time to move forward with a complaint, there's really no place to go with it until we get a lawyer, whether it be on a private contract or whether there be a lawyer directly assigned to public health to represent the boards. So I'm not sure how long our list of pending complaints is, but I think it's over 25 or 30. And they just sit there, and the people who file the complaints get very, very frustrated because we can't take it anywhere. Along that line, too, I think that most of the board members would agree that what public health needs to serve all the boards, medical, chiropractic, all the boards, is a full-time investigator. So if somebody was to complain that so-and-so is practicing without a license, then there could be an investigation properly done by an investigator, and that could be reported back, and we can move forward with it. But right now, each board member is like, if there's a chiropractic complaint, then I would be the investigator. but it's ideal to have a professional investigator do it. I also am concerned with, there's a trend in Guam in chiropractic, physical therapy, and acupuncture. We call those the hands-on professions, where there appears to be illegal providers, untrained providers, uncredentialed providers showing up in these new spas that we see pop in open around Guam, where yes, you can go get a massage, but they might do spinal manipulative techniques, they might do acupuncture, they might do physical therapy procedures. But then again, without an investigator, we can't really get anything done. And my fear is that's going to continue to grow to the point where it just becomes normal to practice without a license in certain situations. I really think a new section should be added to 10 GCA. It would cover all the boards and basically allow the boards to prosecute illegal providers, because we have been instructed by the AG's office that since we did not license the people in the first place, we have no purview over them. We have to drop all the complaints because they're not our licensees, so it's not our business, basically. And so I would like to see a new section in 10 GCA where basically gives the boards the power to fine illegal providers, up to $5,000 or $10,000, and then, with increasing penalties with continued disobeying of the laws. But right now we don't have that power, so then it goes to the AG's office, but they're stressed right now from what I understand, so nothing really happens. And I'm personally afraid that, I call it the red light syndrome. Many of us don't realize that when you approach a red light on Guam, or a yellow light, that you're supposed to stop. Most people go through it, and it's kind of an ongoing joke on Guam. We laugh about it, but pretty soon that could be the same thing with these illegal providers. They are brought over from East Asian countries, they're put to work in these spas, and they have no training. As a matter of fact, I'm sure the senators know that on Guam, even to do massage therapy requires zero education. There's no certification or anything. They basically need a business license to work in one of those places. But they're also bringing over things that they used to do in their old country. But see, we're not in their old country. We're in Guam. Guam has laws about chiropractic and acupuncture and physical therapy procedures that must be obeyed. So that would really help if we can have an investigator and then add a section to 10 GCA. And then HPLO, they work really, really hard, but they really need an infusion of money and time and expertise to really update things. They're slowly getting us digitized, but it really should have been done a long time ago. I realize COVID put an end to that, but right now, it's just the process of renewing a license on Guam for allied health, because there's so many professions that have so many different regulations as far as their continuing education, that it's a process just to get your license renewed. It should be able to go online, go through some questions to make sure you are the person, verify your identity, and just basically click and pay your bill. And I'm thinking about my Washington license. When I renew my Washington license, it's just one page online. I click, and when I click it's an affidavit that says I'm open to random audit of all my CMEs. I think we're at that time where we don't have to make our renewals so arduous. So these are a few of my ideas. These are things I'm going to try to push. Thank you for the ability to testify.
Sitos Masi, Dr. Miller. I'm noting, from what I could gather, that this is your 13th term to serve on the board. You've been serving for 36 years on the Guam Board of Allied Health?
Not continuously, no.
Oh, not continuous.
No, Governor Camacho removed me from the board for those 8 years.
Okay.
And then when Governor Calvo came in, they actually approached me and asked me to go back on the board.
Okay.
Yeah.
So, all right, because I've got from 1985. All right, so how, that's minus 8 years, 36 minus 8
Yeah,
years.
yeah.
That's still a lot of years. So thank you
is.
for all those years on this board. And I know that you've pretty much been the ones to establish the rules and everything as you've been going along. So I look forward to the changes that you're also proposing to make going forward. And I've always been open to legislation, so if there's any legislation that needs to be done, it just takes a correspondence from your board. I wanted to ask you, so, but recently you've been on the board at least for 3 years.
Correct.
And, all right, and so according to the papers that I received, that expired February 2024. We've got 90 days plus 3 legislative days still to act, so it still seems to be valid. What about, all right, I had asked HPLO some questions, but I have not received a response yet from them. Pretty much just wanted to make sure whether the people who are being reappointed to the board had been able to attend the meetings. I wanted to see the attendance rate. Are you having any problems attending the meeting?
No, actually not at all. Every once in a while, maybe once a year, if I'm traveling.
Okay.
But that's it. And I'm pretty sure of all those years I've been on the board, I do not remember any time that board not meeting because of lack of a quorum. The people who serve on the board are very dedicated to the board. You know?
Great to hear that.
Yeah.
Thank you. That's what's going to be my next question. That's perfect. So the other thing, and this is related to your recommendation that there be a full-time investigator, that of course we have attorney issues. This has been something that has been discussed since I became the health chair. So I remember we had oversights, we had several hearings, we made sure the law was in place that allowed you to hire investigators, lawyers for different parts of the prosecution, or, you know, the, for licensees. But that's correct, that's from licensees. I've not seen that AG opinion that was written or told you that you cannot do anything with those who are not licensed, the unlawful practice of something that requires a license. If you got that, I'd like to see a copy.
It wasn't, sorry, I interrupted you. It wasn't a written AG opinion. It was when Rob Weinberg was with our board. That was the first time I heard it. He said, if you didn't license them, then you have no purview over them. And my retort to him was, you know, part of our preamble to our practice, or the Allied Health Board, is to protect the public. So if someone's practicing within the scope of our licenses, but doesn't have a license, then we should have some purview over them.
I think so,
And he
too.
said, no,
All right.
you can't do anything. He said.
I'm going to write that then as a formal, to get a formal opinion from the AG on that, because, for example, the unlawful practice of law is definitely governed by the people who are governing our law practice, right? Same. So
Right,
our
yeah.
license. So, okay. But, and then the other thing was, so there is authority to use your funds to hire lawyers to, or an investigator, and also to hire lawyers to do the different parts of the process for the licensees or those applying to be licensed. I wanted to ask you whether the board, the Allied Health Board, was getting reports of its funds, how much and how it's being spent, and, you know, that your ability to hire those people.
From what I understand, I've never seen anything come from the lawyers. And again, this is my understanding that when public health hires the lawyers for HPLO, it's not just for Allied Health, it's for all the health boards. And what we were being told is that the medical board pretty much drained the pot, so to speak, in prosecuting some of their complaints. But I've never seen anything from the lawyers that were hired as to, okay, there's $100,000, you know, that they bid on, and then how much of that was used up? What was the result? No, nothing. It is, you know, you kind of blame things on COVID and stuff, but it's very frustrating because even with the private lawyer, it seems very difficult to get anything done.
Yeah, that's what I'm asking, because there was comments in the paper recently by Dr. Terlaje, the chairperson, saying that the issue is, not having lawyers, but for me, the statutes are very clear. You're able to hire them. You have your revolving fund, your own revenue that you are making based on the charges that you're making, or the testing fees, the licensing fees, the renewal fees, all of that is up to you to set, and you're supposed to set it so that you have enough to hire your own lawyer or share a lawyer. I thought it was HPLO's recommendation that you shared a lawyer, shared an investigator, and that's how they were managing it. But if you're not getting those services from the contract, then you have to make sure you're not using any of your revenue for it, and you need to use your revenue to get your services for your Allied Health Board. That's something we've tried to make very clear during our repeated oversights and other hearings on other nominees. So this is something I think it really has to be made clear to you. So Mr. Pareto, Dr. Pareto, you're the vice chair of this board. Please follow up with that. And because I know this has been the frustration for many of the boards, and those who aren't bringing in any revenue, I can understand that they might not be able to do that. But those who are or have the ability to do so, need to bring in your revenue, hire a lawyer, get the contract to be so that they're going to respond to you when you need it. Otherwise, you have to re-examine your fees to see if it's enough. It's supposed to be that revolving fund for those purposes.
Right.
But I did see in an article that, or maybe in minutes, or an article regarding one of your recent meetings where they had supposedly packaged several complaints and given it to the Attorney General's office. And according to Dr. Balahajas, he's received no response from the Attorney General's office. The Attorney General, in his response in that same article, said, all it takes is a phone call. I'm not aware of this. If I was, I would follow up on it, and I will do that right now. So I'm just going to let you know that, if you didn't read that article, that according to him, he thinks he's timely responding to any agencies that's calling him for, follow-up. So if you could please do that. If that's an issue, please put it in writing to me that this has been our practice. There's been no responses. So that we can get it very formal. Otherwise, it's a he said, she said, and he's denying it.
Yeah.
All right. So the other one that I wanted to say, okay, so massage is currently not regulated by the Allied Health Board.
No, we don't have a Massage Practices Act.
Okay, and so that is something I'm wondering, with the authority that the Allied Health Board has to add additional practices within its scope, if that's something that they have considered. I know, if I recall correctly, there have been several proposals to regulate massage, but maybe they have not gone through. So I'm just wondering if on your side, that's the legislative side, but on your side, if there's been any attempt to bring in massage under the Allied Health Board. I think you have that authority to propose that they be governed under your board as well.
But
So,
they have to have a statute prior to us establishing regulations?
it's not clear. It says you can add it, and then you create the rules and regs. But because your statute right now says you can add any health profession that is not currently has its own board. So I guess we could also do a statute if you have one, or if there's any that's been proposed. My only recollection is that there have been at least two that I was aware of. They both failed. So if you have recommendations, we're open to that as well. But that's one way to look at it. You could put that you could propose that they be included under your board. And the online, I'm glad they're finally making these things online. At their current track, does it look like it's going to be satisfactory in the end?
Well, this is a renewal year. We do every other year. And the renewal form that's being proposed is, what, 5 pages long? And part of that is not because we're digging for information. It's that there's 13 professions, right? Not all the professions are the same as far as how many CMEs they need, whether or not they need basic cardiac life support. And so it's a bit of a task for a licensee to get this thing and look at it. And you probably heard Chairwoman Balahaja always say, people never read their applications, they just kind of fill it out. And it could be so much more simpler. But right now it's complicated as far as I'm concerned. But we're kind of stuck because we, like the medical board, they only do 2 professions, medical and osteopathy. And so it's pretty easy. But with all the professions that we deal with, and they're not all the same as far as their CME requirements, and trying to get all that into one form, it's when those forms get handed out, probably next month, people will complain, they won't read it, they won't get it right. It just makes for more work for the staff.
All right. From what I can tell, the board controls its forms, its fees, its rules. So maybe that's, make suggestions to the HPLO staff, see if they can help you to separate the forms or do whatever you think is what you recommend, and proceed.
Yeah, they're doing that now.
Okay, then. So that's what I'm saying. So in the end, on the current track, do you believe these forms will be more user-friendly?
Well, I believe that the current track would be to digitize everything, and then instead.
But is that their track?
Yes, it is.
Okay, that's why I'm asking. Yeah.
Yeah, that's their hope, I think.
Okay, that's what I'm saying. So if they proceed with their current track, we're going to get to a place where you would be satisfied as well.
Yes.
Okay.
I believe so.
I'm pretty hard to satisfy when it comes
Okay.
to when it comes to paperwork.
Then you keep plugging away at that, Doctor, and keep making recommendations to HPLO. I think they've been very responsive to me about any form changes or something that they could make. They seem to be very open to that.
And that's been the task of an ongoing work group that's been meeting regularly to finalize the renewal forms so that it is clear what the applicants have to submit when they renew their license. And so we're pretty much at that point where we're able to finalize that and send it out to the licensed applicants.
Okay, great. All right, the last thing I want to do before I open up to the other senators for questions is there was a written testimony from Dr. Mamie Balahaja for all of the appointments in this hearing today. It says, "Dear Speaker and distinguished senators, thank you for the subject hearing notice on the appointment," and she lists all the names. Given that the current composition of the board is limited in numbers and barely made a quorum at a monthly meeting for the last 4 months, the above-mentioned health professionals, once confirmed, would commit the board to conduct businesses more swiftly. The reappointment of Dr. Miller and Katherine Nicholas, once confirmed to serve, is a relief, being that they both have already shown commitment and dedication on the board. The addition new board members, namely Dr. Kim, Dr. Harper, and Ms. Tiding Fong, with their expertise and interest to serve on the GBAHE, would add credence to the licensure process. I wholeheartedly welcome all health professionals appointed by the governor to serve on the only licensing board that is composed of 14 different disciplines in healthcare and whose primary purpose is to protect the public. I regret greatly that I will be absent at this very important subject hearing. I'm currently off island, destined to attend the American Psychological Association annual convention in Seattle. On behalf of the current sitting board members, we appreciate greatly the appointment hearing of additional health professionals to the Guam Board of Allied Health Professionals, health examiners. Very sincerely, Mamie Balahaja, EDD, clinical psychologist, chair, GBAHE. She says 14. I just personally counted 13. How many are there?
We should know this. Yeah.
13? 14? Okay. Anyways, well, I'll follow up with HPLO on that. All right. And with that, I have no further question for you, Dr. Miller, I'm going to ask Senator Tiding if she has any questions or comments for Dr. Miller.
Thank you, Madam Speaker and Chairwoman. Good morning to my colleagues, and of course, good morning to the two of you. Dr. Miller, and just for the record, and Dr. Miller is my chiropractor.
Okay.
I've used him for many, many years. And every time I go in there, it's not just my back we talk about. We talk about politics and the needs that Guam, for Guam, the needs for Guam. And you've been very, very good at providing your opinion on how things should work. I mean, there's one thing to have individuals to complain, constantly. That's easy. Complaining is so easy. But they never have a solution. I know you've been sitting on the board for quite some time, and I appreciate all the questions the speaker had. That's why I love being in her committee, because I don't have to ask anything. I just could be the good guy now and just talk about the accolades that you have, and I know you have many. But there is one thing that I am hoping that you do, Dr. Miller, is because of your tenure being on this board for quite some time, I'm hoping that you'll encourage other chiropractors to come and sit on the board. Reach out to them, get them involved. We've got the next generation. I mean, I'm close to retirement, and I'm hoping you're not retiring soon, but there's going to come a day when all that institutional knowledge that you have for so many years you've been sitting on the board could be passed on to the next generation, because we're going to need that knowledge and know-how and the history to keep moving on, so we don't have mistakes being made, of the same mistakes being made, that is. You mentioned trying to make the board meetings. Have you guys been on Zoom at all? Do you utilize Zoom? Because we found out that that's very effective. There are more people who show up when it's on Zoom than when it's in person. So I'm glad that you're utilizing Zoom. So it doesn't matter where you are in the world, you can participate. And you made a comment about, the red light and the yellow light. I totally agree. But I think the saying goes, red means to stop, green means to go, and yellow means to go fast to beat the red light, if I'm not mistaken. But funding. How does the Allied Board get funded?
The board itself collects the fees for initial licensing and for renewals, and occasionally fines. And then all the rest would come through appropriations for HPLO. Well, Catherine's here. She'll be up there. She's our treasurer. She has the numbers. Yeah. But I don't think we would even come close to having enough funds coming in to hire a lawyer for even a short period of time.
So you've been on this board for quite some time, and some of the concerns are still lingering. Since 2021, there was a report out that there had not been for several years any complaints that had been addressed or been filed into court for any of these concerns. Do you think it's more a lack of funding, or is it more a lack of the law giving you the authority to have an attorney come and assist you? Or is it funding, or is it legislation that's needed to correct this?
Well, funding always precedes everything. So if we had a lot of money and we could just put a lawyer on retainer, we could clean up a lot of these complaints. Some of them would be just within the board itself. Some of them might go to court. And then as far as the law, I had mentioned that this was not an official attorney general's opinion. It was just at a meeting, but it was told twice that if we did not license the person, then we have no control over it.
That's what you explained earlier.
Matter of fact, my retort to Attorney Weinberg says, I told him, I said, that if that's true, I'm not a lawyer, so if I went and started practicing law, nobody could really stop me. And he didn't like that, but it's the same thing, right? So I would love to see a law an amendment to the law or a new addition to the law that would allow all the boards, the health boards, there's several of them, have the authority to fine people for practicing illegally. Now, obviously, you need an investigator for that too. So a lot of it could be taken care of within the board's purview without really having to go get a lawyer, because then we would also have the AG who sits with the board and guides us, say, well, no, you can't do it that way, you can't do it that way. But I think if we had a law that simply said it's a $10,000 fine each time that you are known to practice chiropractic, acupuncture, whatever profession, without a license, that should slow down the spread of this. My fear is what's going down now is if you are observant enough, you'll see all of a sudden these spas are opening up. Now, when it says spa, that kind of indicates turning into almost like a clinic as opposed to just massage, that what we're going to do is this and that. And I can name probably 5 places that I've had patients said, yeah, you know, the guy was massaging me, and then all of a sudden he started manipulating my spine. Or they started to do acupuncture procedures like moxibustion and things like this. And it's not that these are bad people. It's a lot of it is where they came from, is Eastern Asian culture, where chiropractic procedures are you know, chiropractic's a United States profession for 125 years now. Now, it might be different in East Asian countries as far as who can do these procedures. So they, meaning the masseuses, are recruited over here, and they just do what they've always done. But see, they're not in their home country. They're in the United States now. They're on Guam, and we have our laws. Okay. But I'm afraid, you know, the red light thing is, of course, now, when I go through a red light, just a bit of my own guilt, right? When I approach a red light, or yellow is turning red, I look in my mirror. If someone's behind me, it's dangerous to stop. And the point I'm bringing up is we become accustomed to people breaking laws, and we don't really do much about it. And so if this continues to grow, it's going to be a problem. Then what the chiropractors fear is someone's going to get hurt, and they'll claim, oh, this chiropractic procedure in this massage parlor hurt this person. Then all of a sudden makes chiropractic look bad. And it's not the way it should be. But
well, okay, so let's simplify this. Has the board come to a money amount to assist them? To an amount of funding they need in order to hire an investigator, hire an attorney, full-time attorney? Have you come up with that money amount? Do you know how much that will cost? And Kathy's going, no, we haven't. Okay, see, yeah, that's the biggest problem. If you're lacking funding and we don't get a money amount brought to us, we don't know how we can help you, because you're putting all these rules and regulations. I know your stipend is still stuck at $50 since 19 Forgotten, that you have no stipends during subcommittees, and these subcommittees are put together to create these rules and regulations. And if you do all this work and then no enforcement, what good is any of this? So we need to know that money amount. You know, there is some excess funding, you know, that all my other colleagues are grabbing into the pot. And I think this is so important. The Allied Health Board, the medical examiners are so important toward our healthcare on this island, that we need those numbers. And I know Kathy, I'm probably going to ask her when she comes up, you know, what are those numbers that we need, that we can maybe assist the Allied Board. I don't believe also in throwing money at something to get rid of the problem either. That's never been a solution for me as well. I need to find the amount and what exactly this money is going to do and what it's going to yield at the end. So that's important. I'd like to talk about the stipends. Maybe that's something the board does on their own that they can recommend, or is this by law that they've been receiving, what, about $50 stipend since 19 Forgotten, right? So you might want to put that in a request too to the chairperson about that, especially when you have quite a bit of subcommittees. And that becomes the bottleneck, because you can't get, you know, those volunteers to show up to do these subcommittees that are very important. You when you talked about the business license, what you said, you can't go after and enforce those that don't have license with the allied belt. But these companies or these businesses, they have business license from Rev and Tax, correct?
Yes, they
Okay,
should.
so they have the business license, but they just don't have the allied health license, right? That they're
There's
supposed to.
no license exists for that.
There's none.
Nothing,
But
no.
yet they have business license from Rev and Tax? Doing
Correct.
business as massage therapy, doing business as services?
Just like landscaping, anything else, you know?
Yeah, okay, so that's, now we have to connect Rev and Tax into this mix.
Massage is not regulated, that's why.
Right.
So,
Or if the Allied Health Board is creating rules and regulations to regulate these type of services, then we need to get Rev and Tax involved if you guys are working on these rules and regs, because they can bypass everything and just go into Rev and Tax, get a business license, and put service.
Right, that's what happens.
Yeah.
Yeah.
So I think we need to get them involved too as well. You know, when it comes, maybe you should bring them to one of your meetings to tell them where that issue is there. But I appreciate Dr. Miller. You could be climbing or going and visiting places all over the world and do something but to stay back and help our island to be a better place, a safer place to live is commendable. And I thank you for that. And I thank you for not retiring, because I still have a back problem, you know, that I'll have to come see you with
Okay.
it. But again, I encourage you to bring that next generation aboard. You know, find somebody that you can mentor in the chiropractor field, new generation, and encourage them.
I will. We're working on that.
Yeah, because I know you truly, you love the Allied Health Board. I mean, you wouldn't be doing this for all these many years. And to retire and not have somebody to continue your legacy, I think that would be a great disappointment.
Yeah. I appreciate that.
Thank you. Thank you, Madam Speaker.
thank you. I'd like to clarify a couple of things. So first of all, I think we need to separate the complaints that the board receives for those who are licensed and what is the outcome of those versus the complaints that you're putting into another category of unlawful practice without a license of things that should be governed by this board or licensed by this board, and how are those being prosecuted. And it's maybe you could just talk a little bit about that. So the complaints that you receive that are regarding licensees, what is the progress of those? What is your status?
The ones that have no progress are the ones that require an attorney to prosecute. So those are just kind of sitting there. But there
For
are
licensees.
licensees.
Okay.
But there was one, for instance, had to do with chiropractic. A chiropractor went on vacation, and prior to going, hired a chiropractor to come in from the States and take over the practice. And it was, quote, understood that you have to, quote, get a license. Well, the substitute chiropractor didn't get a license, so he practiced without a license. And that was relatively simple. It went through the board. It started with a complaint because somebody found out this guy was practicing for a couple of weeks without a license. So there's two people involved there. The one who practiced without a license, and then the chiropractor who hired that person was also culpable. And that went through. The chiropractor who was licensed on Guam paid a fine and one or two other things, I think, put an ad in the paper, and it's closed, and that's the way it should be. Those are relatively simple. And that's kind of one of my passions is to regulate, we can just have the simple stuff where the board can just issue a fine, and then you can usually just negotiate it at the board without having going up into court systems and stuff like that.
Yeah, so the question is, you have that authority. Are you using it? Is it being done?
Yeah,
Okay.
but it's still too slow.
Too
You know.
slow, then that's
Well, the ones that require the attorney are just sitting there.
Okay, the ones that
Most of
require
them
an
are
attorney,
ready,
I saw in one of your minutes that they said they packaged them up and they're giving them to the attorney to hurry up and finish and get response, right?
Right.
It's just a matter of following up and somebody has to do that, right? Or your contract with your attorney. I don't know, that's your private attorney, right?
Correct.
Okay, so then that's a matter of your contract with your private attorney and how you're going to get those things done and processed. But I just want to make sure that it's understood, it's totally within your purview. That contract with the attorney, I guess this HPLO is trying to make it facilitate it, but it's really your control. So the board has to be the one to control its funds. If it's not enough funds, we have to deal with that, right? I feel like, so what we have done regarding funds is the HPLO is given all of the revolving licensing funds. They're supposed to be allocated. This was taken care of years ago where they were going to be allocated for the first time to the different boards based on what they brought in so that you would know immediately whether you need to bring in more money. That's kind of the, but in addition to that, we also put general fund monies to public health. We've given them the authority to move funds around in public health, and HPLO has to make its case to public health that why it needs more funds than it is bringing in, right?
Right.
And that has to be done, and your board has to be the advocates for itself in that regard. I want to say that HPLO, according to documents I can find for FY 2025, has put in a much higher request than what public health has given to the legislature. So public health's request for HPLO is maybe 300,000 versus HPLO's request to public health was about 500,000, or even maybe those numbers are not correct. But it's something like that from the general fund. That's in addition to the special fund, the revolving funds. We do fund HPLO with general funds, right? So you just really, I'm going to recommend again that because you're vying with these other boards, you're going to have to advocate for yourself with HPLO to get your share of your funds, all of it, deal with it the way you want to deal with it, and if it's not enough, deal with that with your fees, and also the general funds that's being allocated to HPLO or to public health, that HPLO gets what it needs as well. Public health doesn't seem to be convinced that HPLO needs what HPLO is asking for because they ask for less for HPLO.
Yeah,
okay?
I understand that. Yeah.
So HPLO is the Health Professional Licensing Board, the overall entity for all of this. But the other thing I want to make clear, so that other pot of complaints, the ones for the unlawful practice, your statute's very clear regarding unlawful practice, that it is within your jurisdiction, your board is going to, well, it just says, it doesn't say what the board, it says the board may petition the court having jurisdiction for an injunction. So that's to make them stop their violation of practice without a license. That's one that the board has the authority to do. Other persons can do that as well. The Commission on Healing Arts can do that, or any other person, it says. And it says there are fines. You can also recommend these be increased, but the fines right now is $500 maximum for each violation. Each day that a person practices in violation of this article constitutes a separate violation. The court, the board or the commission can seek other remedies available by statute without first seeking a cease and desist order. It also says that, in one part, it says, any person who practices a healing art profession without an appropriate current valid license as regulated by this board shall be guilty of a misdemeanor upon the first offense and guilty of a felony for second and subsequent offenses. No person without a current valid license may receive any compensation for services so rendered. Now, because we're talking about misdemeanors and felonies, those are criminal complaints. That is why the AG must bring criminal complaints. But it has to be, if you are aware of it, make sure that they are aware of it. So make sure that they are. And this opinion that you got from Weinberg, that's not in writing, perhaps you bring that up again with your new lawyer, right? Or whatever lawyer is assigned to the board, that how do we handle these? The unlawful practices, we're just going to package them. We're going to do our own investigation, do whatever we can, and then package them. And then it's up to the AG whether they're going to prosecute. And then it's up to our board whether we're going to seek an injunction with our own attorney in the court to make them stop. But whether it's misdemeanor or felony will be up to the Attorney General to charge, right?
Right.
But the other ones, those complaints, as Senator Taitigui was asking about the complaints for licensees, do you believe that they are, you gave us the one example, but are they pretty much, I guess you said they are efficiently processed up to the point where they need a lawyer, and then that's where the delay happens? Okay, so I'm just going to encourage that you make sure that this communication with the lawyer in light of the AG's response in that article, that be put in writing, followed up, phone calls, whatever has to be done. And then, yeah, I'd like to see something formal on that. Kind of like, this is how many cases we refer to the Attorney General's office, and this is their status as of, 1 month, 2 months, 3 months, something like that. Thank you, appreciate that, Dr. Miller. I'd like to welcome Senator Roy Kanata. Thank you, Senator, for being here at the hearing. We have several nominees for this board. We started with Dr. Miller. So if you have any questions or comments for Dr. Miller.
I don't have any questions or concerns for Dr. Miller. I just wish him all the best and thank him for his service to the community. I personally haven't seen a chiropractor for any reason, but wish you all the best and thank you for your services to the community. And my office remains open if you need any support for any legislation, okay? Thank you so much again. Have a great day.
You're welcome.
Jesus Masi, Senator. Again, thank you, Dr. Miller, and congratulations on almost 40 years of practice, you said, and so you're over 25 years serving on the Guam Board of Allied Health.
43 years of practice.
43 years.
Almost 40 on Guam.
Oh, congratulations. Yeah. And thank you for serving the board. And there's still much work to be done, obviously, so I appreciate your willingness to continue to serve.
You're welcome.
Thank you, Mr. Beretta, as well. All right. Our next agenda item we're going to move forward is the reappointment of Katherine Nicholas to serve as a member, Nutritionist, Clinical Dietitian Representative to the Guam Board of Allied Health Examiners for a term of 3 years. From what I can find, Katherine Nicholas was previously on this board as well, or just recently serving on the board from 2021 to 2024. Is there service prior to that? Okay, so you can talk to that. But I'll now, actually, for Katherine Nicholas, just a minute. We've received written testimony from Subo Crisostomo, Guam Board of Allied Health member, Jennifer Cruz, Chief Nursing and Ancillary Officer at GRMC, Vincent Pereda, Vice Chairperson of the Guam Board of Allied Health, Godfrey Wong, Community Nutritionist 2, Christine Mendoza, Clinical Dietitian at GRMC, Sharon Azucena, Clinical Nutrition Manager at GMHA, Lenora Beth R. Mantanani. Those are written. And if there's anyone who wants to provide oral testimony today, please come to the table. Mr. Beretta, you may proceed.
Thank you, Madam Speaker. Good morning, Madam Speaker and other members of the 37th Guam Legislature. My name is Vincent Pereda. I serve as the Vice Chairperson of the Guam Board of Allied Health Examiners. I am here today to support and endorse the reappointment of Ms. Katherine Nicholas as a member of the Guam Board of Allied Health Examiners. As a previous board member, Ms. Nicholas served as the Dietitian Representative on this multidisciplinary board of Allied Health. In her present professional capacity, she is employed as the Clinical Dietary Service Manager for the Guam Regional Medical City. And in this role, she brings a wealth of experience and working knowledge that greatly benefits the board in its deliberations and decision-making relative to licensure procedures and regulations. In addition to her regular duties as a board member, Ms. Nicholas also has taken on the initiative of participating in several work group meetings aimed at improving licensing issues and concerns. Additionally, Ms. Nicholas served as the board's treasurer, regularly providing important financial information pertaining to the board's function and operation. In closing, I would like to strongly urge the legislature to confirm Ms. Katherine Nicholas' appointment to the Guam Board of Allied Health Examiners as soon as possible. Thank you.
Jesus Masi, Mr. Pereira. And now Katherine Nicholas.
Manana Sizuus, good morning, Speaker and Chairperson Therese Terlaje, and the Committee on Health, Land, Justice, and Culture, Hafaday. Sizus Ma'asi, and thank you for giving me this opportunity to speak on my reappointment confirmation hearing for the clinical dietitian, nutritionist seat of the Guam Board of Allied Health Examiners. My name is Katherine Cruz Nicholas, better known as Kathy, and I am a registered dietitian nutritionist, licensed as a clinical dietitian nutritionist with the Guam Board of Allied Health Examiners. This will be my second reappointment to the Guam Board of Allied Health Examiners, as I have served in this seat for the past 6 years. At my last confirmation hearing, I shared a little bit about myself so that you would know how I arrived at being in this seat and why I had accepted it. And since committee members do change, and for the sake of Senator Roy Kinata, that only learned of me today, I will share the shortcut version. So here's the history. I have been a registered dietitian for over 37 years. My career launched after graduating from the University of Hawaii at Manoa with a Bachelor's of Science degree in Food Science and Human Nutrition and a Master's in Public Health degree in Nutrition. In 1987, I returned to Guam to immediately start work at the Department of Public Health and Social Services as a nutritionist for the Guam WIC program, in fulfillment of my World Health Organization, or WHO, fellowship requirements. 4 years later, I transferred to the Guam Memorial Hospital Authority in 1991, and at the asking and convincing of the late Dr. Olivia Cruz, who was the medical director at that time. But the licensure of dietitians and nutritionists had not been established at that time. So during my clinical work at the hospital, I had helped the late Senator Dr. Eduardo Cruz and his office with reviewing the first drafts of the bill to license the profession of dietitian and nutritionist. Article 21 was added in Public Law 24-329 on August 4th, 1998, and the rest is history. Fast forward 16 years, I had retired from Guam Memorial Hospital as the hospital dietary administrator in 2014 and was immediately asked to help create and build the food services operations at the new private hospital by the contractor Global Food Services. That experience took me further to assist the dietary operations at the Naval Hospital, and a couple years later, I was asked to join the Guam Regional Medical City Partners and help manage the Clinical Dietary Services Department at the hospital. Through my dietitian years on Guam, I have also worked as a nutrition instructor for the UOG College of Agriculture and Life Sciences, a dietitian consultant for Catholic Social Services, a preceptor for students on Guam attending the Penn State University Dietetic Technician Long Distance Program, a volunteer and mentor for the Certified Dietary Manager who was reviewing and improving the menus for the Elderly Nutrition Meals Program. And I served on the National Diabetes Education Program as Guam's representative of this joint partnership between the National Institutes of Diabetes and Digestive and Kidney Diseases of the National Institutes of Health and the Centers for Disease Control and Prevention. It was in September 2017 that UOG nutrition professor, Dr. Tanisha Franquez Afligui, whom had been under my mentorship in her pursuit to be a dietitian, asked me to consider serving on the board of Allied Health Examiners. That was the impetus to my first appointment on this board, and I have remained committed to serving the board in various capacities. As the first dietitian nutritionist to be licensed in Guam, I do have license number 01. I am already familiar with the process of attaining and maintaining licensure on Guam, and I can relate to our licensees. So now you know my background information. I will now share my board member experience to explain why I have agreed to consider another term for reappointment. Number one reason, no other clinical dietitian nutritionist among our dietitian network in Guam was interested in taking over my seat. And number two, there's much work that I've started which I would like to finish. So I'd like to tell you about that. Number one, the treasurer of the board. It was after my first confirmation of my appointment that I was immediately elected treasurer of the board in 2019. In this office, I seriously worked to make sense of the financial information specific to the board and started reporting actual numbers of the budget appropriations and expenditures to include board revenues and expenses at the monthly board meetings. This reporting helped determine that just with fees alone, we would not be able to sustain our operating expenses. Although I am now ready to pass the torch to another board member, I'd like to assist the new treasurer in the work ahead, as it involves looking at the revenues of the board and determining how we could afford needed positions that would support the board's functions. These positions include that of the investigator, prosecuting attorney, and administrative staff. Number 2, updating the scope of practice for the dietitian's nutritionist discipline. When one of our nutritionist licensees came before the board to request the ordering of nutrition-related laboratory tests to be considered in the scope of practice for the clinical dietitian nutritionist, I did the literature search and found that in the Federal Register, Volume 79, Number 91 of the Department of Health and Human Services, that the CMS final rule, CMS is Centers for Medicaid and Medicare Services, allowed hospitals the option of granting order writing privileges to qualified dietitians or clinical qualified nutrition professionals if it's consistent with state law. So this set the stage for dietitians to order diets as well, which has been supported by CMS since July 11, 2012. From this, I worked on updating the scope of practice for the clinical dietitians nutritionists to include ordering privileges, and it eventually was made part of Public Law 36-138. But it's not over. Now there's a need to update the qualifications of the clinical dietitian nutritionist discipline, as the Commission on Dietetic Registration, that's the credential agency for nationally recognized registered dietitians, recently changed the minimum degree requirement for eligibility to take the registration exam for dietitians from a bachelor's degree to a graduate degree. So this went into effect on January 1st, 2024. I like to help write the language to include this requirement in the education qualification for the dietitian nutritionist discipline and work with our legal counsel to properly do this. Number 3, continue to be on high alert to the misuse of the title nutritionist on Guam. In the 6 years that I have been on the board, there's been a total of 5 occurrences by which I've had to advise individuals or organizations of the misuse of the title nutritionist when the individual or position is not licensed with the board. The title nutritionist and also dietitian is a protected title under Guam law. Number 4, serve as legitimate resource in helping dietitian nutritionist professionals on Guam. When attorney Rob Weinberg tasked members to help find references to write up the code of ethics specific to our discipline, I enjoyed doing the literature search to reference a code of ethics for dietitian nutrition discipline from the Academy of Nutrition and Dietetics. Also, I found it enlightening to advise dietitians about the improper use of the title RD eligible. Now, being a board member has its advantages in knowing who's currently practicing clinical dietetics and nutrition in Guam. Currently, there are a total of 36 licensed professionals, 33 dietitians, and 3 nutritionists. Of the 33 dietitians, 23 work on Guam, and 10 are from off-island. And surprisingly, there are 3 who are not practicing at all the profession, but just want to be licensed in the event they are called, I guess. Since this profession became regulated, Guam has issued a total of 77 licenses for clinical dietitians and nutritionists. And I still get excited over reviewing each of the applications for licensure. The downside to being a board member, it's labor intensive to review all the 30 hours of continuing education activities and certifying the eligibility for license renewals of each of the 36 licensees for the profession of clinical dietitian nutritionist. It also takes up much of our time. Right now, I'm on paid time off to be here. But because of reason number 1, somebody's got to do it. And I believe that somebody is me, because I'm committed to the mission of the board. So thank you, Speaker Therese Terlaje and committee members for inviting me to speak at my confirmation hearing to be reappointed to the Guam Board of Allied Health Examiners. Sizus ma'asi hamsa todos.
Mr. Nicolas. And I appreciate your wealth of knowledge and experience on the board as well, and your extra efforts to handle the finances for the board. This is what exactly I thought we had accomplished a couple years or several years ago, that each board was going to be much more aware of its own finances through its own members and monthly or board meeting reports of this. So thank you very much for that. Can I just ask, have you been able to make the meetings despite your practice? Yes, okay.
Yes.
And your recommendations and or the work that you have outlined that you still want to do on this board, I appreciate, and so I look forward to that. And I was not even aware that there were that many dietitians and nutritionists licensed here, so that's that's more than I expected, so that is a lot of work. Thank you. On the concerns that Dr. Miller had brought up as to needing investigators, lawyers to proceed with the handling of complaints, could you speak to that? What is your understanding of whether the board is handling complaints efficiently or not? Complaints as to licensees.
Well, it's evident in our meeting agendas that we see the list of complaints. It seems like a litany of complaints, and that seems to kind of take over or table on to the next meeting. So slowly, like Dr. Miller had mentioned, these cases or these complaints are handled. For the most part, a lot of it is referred to the off-island procuring attorney, and that's still pending. You asked many questions on expenses and the report, and so I did, when I first started as a treasurer, I had to ask HPLO for financial information and to make sense out of what the expenses are, the breakdown, and how much are we spending. So this was pretty much what my report to the board looked like. This is back when I first started. Now it's very detailed, because what I've done is taken the fiscal year appropriation, expenditures, encumbrances, and the available balance, and everything has an object class category. So I broke that down, and as well as explanation of the expenses. I've also had records of, since I've served on the as a treasurer, revenues, monthly revenues, yearly revenues, fiscal year revenues from 2021, 2022, 23, and up to 2024. But because my seat expired in February, I only have information up to January of 2024. But it clearly shows that the revenues that we were receiving, let's say an example, fiscal year 2021 was only $43,788. In fiscal year 2022, it was only $15,060. And then in 2023, it went up to $48,694. What has happened and why this fluctuation is because our licenses are renewable every 2 years. So it's not an annual thing, and that's why we see this. We since increased the rates, but we didn't see a dent as a result of it. The appropriation to our board for fiscal year 2024 was $50,022. And what we got as far as revenues in fiscal year 2023 was only $48,000. It didn't even make the cut. At one point, I did try to do a wish list when I knew budgets were being due. So I created a wish list for our board, and with everything we wanted, I didn't hold back, and it came out to about more than $1 million, because I included all the salaries for the prosecuting attorney, the investigators, the inspectors, and administrative staff. Now, when I was learning about this budget, I also saw that we have to share in the lease of the building, and we share in the supplies, we share in the equipment, And we share it with the other, I believe, 9 boards that HPLO is responsible for. So in that exercise, I did submit that to the HPLO, but of course, it was not carried forward. It was just kind of a wish list, and what we got back was 50,000 instead of 1 million.
Yes, so to follow up on that, HPLO is allocating to you from the revolving fund 50,000 or from the general fund?
It's both.
For-
And
How much
it
do you
got
make in your, oh, so you're saying you make about less than
We-
20,000 in your in your own fees?
If I take the 2-year period, it's about 58,848 for fiscal year 2021 and 2022. I'm taking the 2 years that considers the renewal. So since licenses will be renewed this
Yeah, so
fiscal
that's-
year, I'm going to have to wait for those numbers to come in.
Okay, and so you're entitled to all of that. I'm going to clarify why any of that, of your revolving fees, are being used for administrative costs at HPLO, for example, leases and things like that. That's not what you're supposed to use your fees on. Your fees are supposed to be used on prosecution and investigations and handling the complaints and the relicensing costs, such as testing and all of that. But so you're very clear what HPLO is allocating to your board.
This is what I've learned.
Okay,
yeah.
so everybody should know that, and that is.
So
that-
all 9 boards have their own budgets. Each of the budgets have these object class categories from which money has been addressed to share in the costs.
Yeah, so maybe they're taking the general fund that we also give in addition to the revolving fund from fees, we also give general funds to HPLO. So maybe they're taking some of that and allocating it amongst each other. I'm going to get clarification of this,
okay.
but I do know that, again, you need to be clear how much of it is from your fees versus how much of it is from general fund being allocated or paid by HPLO. That's their business, right? Or that's, you can always advocate that they not spend it on this when we need it for this, right? The general fund money that's coming
Yes,
to
yes.
public health, coming to HPLO. But your revolving funds are completely within your control. They shouldn't even allocate what you use those for.
Yeah, when I first started as treasurer, I was wanting to learn, because I'm not a treasurer, any accounting, but I had to learn all these, first the language of what appropriation is, what expenditures are, and then where does it come from. So I had meetings with public health administrative services officer to discuss where are these all coming from. Honestly, it was speaking a different language when you really get into learning where how money is being handled. And so I still would like to, discuss this.
So are you able as a board to determine, you say you're able to determine your overall allocation, but you can't tell how much of that comes from your revenues versus general fund revenues. So that, I think you need to clarify with HPLO. The other thing is to make sure that you're getting all of your revenue. That's number 2. And number 3 is when you said you increased your rates, but you didn't see a dent. When you increased your rates, was it based on your needs?
When we increased our rates, we wanted to make sure that we did it fairly. And so what we did is we did a study of all professional licenses nationwide and see where we were along those rates. And so we didn't want to make any outrageous type of increases. And so that's how we came across increasing
So
it.
that's important to know that if you think you've raised your rates to be comparable across the nation or fair across the nation, that raising them any higher is going to inhibit applications for licensure or something like that.
Well, we did have a public hearing, and there was some opposition to increasing the rates.
Okay,
Yeah.
well, that's what we have to balance, right? So are we going to pay for our own licenses? And that's kind of like the self-governing, right? Why you are governing yourselves. It's licensing yourselves. You're going to take the fees in order to do that, to whatever your costs are for licensure. For all the other stuff, that's what the general fund's supposed to be augmenting, right?
So when I look at our revenues in itself, it's not even enough for salaries for Attorney General.
For an attorney.
Yeah, it's only for 2 fiscal years, we're only bringing in 58,000, 50-some thousand. So that's really so low.
To me, that doesn't seem reasonable. That the fees, the way the statute's written, the fees are supposed to cover your costs, meaning your investigation costs, your whatever it takes to handle complaints and whatever it takes to license people. Meaning if you have to do tests, if you have to do background checks or whatever you do, that all of those are supposed to be covered. So again, I guess maybe we need to sit down with HPLO and determine why the fees are at this rate, and that raising them to meet your actual licensing costs is not feasible. Otherwise, and find out from HPLO, why you can't then. Well, that's why they say they were dividing up the attorney costs among all the boards and the investigation costs. They didn't think they needed a 24 or a full-time investigator for your one board, that they could share that among the different boards. And is that not correct? I mean, isn't that the theory, and why would that not work in practice? Why would we need a full-time investigator for each board?
The amount of complaints for our board specifically is a lot. And I think that was one of the things that we struggled with each year when we see complaints coming in, as far as who's going to investigate this and who's going to take it further to prosecute. And it always boils down to we don't have the available expertise for that.
For the prosecution. You say, both you and Dr. Miller testified that your complaints have gone all the way up to the stage where they need to be given to an attorney to prosecute, right?
Yeah, some of those.
So all the investigation is done, and that is where, that's all really you need, right?
Some of
These investigations are not being done, or are they done?
Well, I can't speak specifically for specific complaints.
Okay, why not?
Because it's not something that we discuss at the board level.
Okay, why not?
And it's only through the investigators.
Well,
Isn't there a report on all the complaints at all of your meetings?
There are complaints that are submitted to the board with regard to a particular issue of licensure, and if it's a complaint that merits investigation, then the formal complaint process then takes place, and then if it's what's been happening is that the board members take it upon themselves to do the initial investigation. Like, for example, if it's a complaint regarding a licensed professional counselor, that would be assigned to me to do the initial investigation to determine how far this complaint should go. Should it go all the way to the AG's office, or is it something that we as a board can handle on our own? So we do follow an established complaint process that the board carries out.
Okay. Yeah, so my understanding would be, if that was done, that all the complaints have been pretty much handled by the board, or is there a delay in the board handling these complaints? Ms. Nicolas, that's what I want to know from you. I want to know your commitment. When you say you're not sure because we don't talk about it as a board, it's very confusing, because I'm thinking you're supposed to, at every meeting, get a status report on all your complaints to make sure that they are moving. That is your job, to make sure that these complaints are moving along. And if they're stuck at the AG's office, like that was in the newspaper, that doesn't make any sense to me. Like, why would a board allow that to happen? Why aren't they following up? How long have they been? one of the articles said that you were just packaging them to give them to the Attorney General. That's very different than they were at the Attorney General's office waiting for action versus they were sitting at the board waiting for packaging to get to the Attorney General's office.
Yeah.
So do you understand my confusion? And I want to make sure that these board members, all of you here who are going to be board members, have to be very clear about that. Like, we have an outcry from the public as to the complaints that are being handled by all of the licensing boards, whether they're being handled first, whether they're being handled effectively, efficiently, or whether they're being, you know, so their conclusion from inaction is that, oh, that's purposeful inaction being, you know, hit under the rug, as opposed to, if there's an issue, let's address the issue. Like, so where does that issue really lie? Is it a matter of the boards not following up with each other as to, you know, are we done with this? Is this now for the AG, or do we vote on it? Is it done? Or, right, these are, if it's a huge issue for me, if it's been sitting at the AGs for 6 months and there's been actually no response at all, which is what one of the articles implied, but the AG says no, that's not the case. So I don't know, but I would like to know if this is an issue, then that's a big issue and that's a formal issue. Let's see it, right? Let's deal with that before the media. I mean, I'm saying media is fine, but you can do that. It's up to you. But if you really want it to get done, let's get it done. Just, I can help you with that. Let me know. Like, what is really the status of the complaints that you're waiting for AG action on versus board action versus HPLO action? That's another thing. If HPLO is just not getting that investigator who they contracted for you to work for you, that's an issue that your board has to advocate for itself, right? So that's why I want to be very clear with all the nominees today as to where these responsibilities lie.
Yes, at our board meetings, each of those complaints are addressed, the status is discussed, but we don't discuss it in detail. We just know where are we at this point. And so the reports will be, it's with the off-island attorney, or it's with the
what do you mean by
procuring
off-island
or-
attorney? What does that
We
mean?
have to procure off-island, right, for,
There are cases that require the expertise of
Okay, specialists, yes.
specialist,
I remember talking to, I think we passed legislation to allow that because we need a specialist in that particular field to actually do a further investigation, right?
right.
Okay, but the attorney, I don't think is from off-island. Is that correct?
That I don't know.
I think the attorney's local. You all board members should know all of this. So I'm going to ask you all to just, you're going to have to dive a little deeper in your meetings. You can't let them lead it. You are the board, you are the leaders. So you lead it. You make sure the HPLO staff is answering to you. You make sure public health is responsive to your needs. And you make sure you can account to the public for every single complaint that is being made and why it's not moving. You have to look at it the way we're looking at it. We are getting calls to our office, things in the media saying, oh, these boards are not moving these complaints. That doesn't make sense to me, given the authority that you have. So I want to know exactly where that issue is, and you each need to know exactly where that issue is, please. That's what we're doing here today. We're making sure that that's very clear to those who are going to be confirmed, that if you're willing to do that. All right, and I believe you are, and I just want to make sure that you know that you have that authority. It's all your power. You are the licensing board. You have the authority to demand use of your fees. You have the authority to, demand from public health and let us know if they are just not responsive at all to the licensing board's needs, because they have complete authority over their budget to give you every additional cost that you need. For example, you have a backlog this year versus last year. We need to take care of this backlog. We need exactly $300,000. That will help us take care of this backlog. You need to just let that be very clear to public health. And we're going to follow up again with public health on their budget, but at their hearing, we did question them. Why are you saying this is all that HPLO needs? They seem to be asking for more, and they have asked you for more, and they just said they would take care of that. That they would take care of it within their overall budget. Okay? So, all right. Any other questions for Ms. Nicholas? Senator Tiding Fong.
Thank you, Madam Chair. And Thank you so much for being here today and stepping up to the plate once again. I've known Katherine since high school, so I appreciate all the things that you're doing at the Guam Allied Board and learning this new, accounting procedures or, a new language like you explained earlier. It does get complicated, and reading the laws compared to what you can and cannot do can get very, very complicated. So it's obvious that you really need an attorney, a full-time attorney there, and investigators, even more importantly, to do the work. But all the questions I had were answered earlier. I just wish you the very best and thank you. We also encourage that you entice other people to come onto the board. And since if you're going to retire anytime soon, please take the time to mentor the next generation to come on. And of course, my office is always open to you. You already have I think you have my cell number. So if you ever need anything else, and looking forward to the conversation that speaker's going to have with the HPLL at Public Health, as well as anything else that meetings that will take place to help provide you the funding you need. $1 million, it definitely needs a few meetings to discuss how it's going to be spent and spent correctly. So I'm willing to support it, if the speaker has any legislation, or we can incorporate it into the budget bill that's coming up this next month. So thank you again for stepping up to the plate. Thank you, Madam Speaker.
Senator Taitui. Senator Kanata.
I don't have any questions. I just support Ms. Catherine's reappointment. I think she has an extensive career, and I wish her all the best, and thank you for your public service. My office remains open to supporting any legislation if needed. Again, thank you for your service, and keep up the good work.
Thank you.
Senator Kanata. Again, thank you so much for being willing to serve longer. Like you said, none of the other 39 dietitian nutritionists were willing to serve. So I'm very grateful. And you've gone above and beyond the work that and doing additional work. This treasure work is very important for these boards if they're going to really be in control and know their needs and know what's the best recommendations to make to us, to everywhere, to public health. And so I'm willing to support any of those recommendations. I just want to make sure that we're all on the same page when we do that we have exhausted all our other avenues of, getting that stuff done. So please make it urgent that the complaints be addressed urgently, please.
I thank you for your comments and your advice. I like to do other spreadsheets so I can remove the lease and rentals of HPLO
Yes.
from our
Yes.
our revenue. So I'll try those
Thank you.
spreadsheets and see what it looks like,
Okay,
and then submit that.
all right, thanks.
Okay, thanks.
All right, so Sidus Masi again.
Masi.
Thank you. We now move to we have next on our list Sungwook Steve S. Kim, MS, DPM, APM. And after that, we have Dr. Velma Harper. I know you have an appointment, Dr. Harper. I'm sorry. We're going to try to do this as quickly as we can. We'll proceed. All right, so Sungwook Steve S. Kim, MS, DPM, APM, has been nominated to serve as a member of the Podiatric Representative to the Guam Board of Allied Health Examiners for 3 years. We'll now accept testimony on his behalf. Sorry. Dr. Borja? Turn on your microphone and start again, please. Yeah. Press the button. Yes. Thank you.
Hafaday, Speaker Terlaje, members of the Healthcare Committee, Senator Taitui and Senator Kanata, family and friends. I am Dr. Therese Borja, and my specialty is in the field of podiatric medicine. Thank you for the opportunity to give testimony for Dr. Sungwook Kim. Dr. Kim came to Mariana's Foot Care Clinic as a podiatry student about 7 years ago and observed for a little less than 2 weeks. He was looking for a place as close to Korea as possible to practice podiatry. Fortunately for us, Guam was as close as you could get to Korea while still being a U.S. territory. He asked if he could be considered for a job when he was done with residency, some 3 to 4 years after that. In those 10 days, we observed a very pleasant, caring student doctor. We took to him right away. He blended in with the staff and helped chip in as much as possible with hands-on patient care. Besides his level of compassion and work ethic, Dr. Kim holds a Bachelor's of Science degree in cell and molecular biology, a master's degree in biomedical science, and a doctorate in podiatric medicine. This is important because it gives you a peek into his mind and capabilities. His practice at the Mariana's Foot Care Clinic includes his very fine use of evidence-based medicine. He is very clinical and has shown great success in his techniques for wound healing and treatment of foot and ankle complications. His practice has shown us how thorough and consistent his patient care is. Dr. Kim became a partner in the practice after about 3.5 years since joining Mariana's Foot Care Clinic. This speaks highly to the trust we have in each other and the practice. We have similar values, such as compassion and mission-centered goals for our patients, but also with our views of family, tradition, and the respect of elders. We are typically supposed to stick to our schedules in clinic, but we have not yet seen Dr. Kim turn away a single patient at the front door in need of help. This does anger our operations manager on and off, but he still does that every single time. I ask you humbly to consider the confirmation of Dr. Kim to the Board of Allied Health, as we are fortunate to have some fresh, new perspective from a highly educated expert as an Allied Health member. His willingness to serve is yet another example of his mission and his compassion for the community of Guam. Sidzus Maasi.
Sidzus Maasi, Dr. Borja. So you serve in the same clinic?
Yes.
Okay, all right, thank you. And Dr. Kim.
Hafade Speaker Terlaje, Senator Kanata, Senator Taitigi, and healthcare committee members, colleagues, family, and friends. My name is Sungwook Steve Kim. It is both an honor and a privilege to stand before the legislature to seek your confirmation to serve as a member of the Guam Board of Allied Health Examiners. In 2019, following the completion of my residency training in New York, I made the decision to move to Guam to be closer to my family in Korea. This transition represented a significant change for me to come from New York City, but it's a decision I've never regretted. As you're aware, the number of podiatrists on the island of Guam is quite limited. However, upon arriving here, I had the fortune to join the practice and collaborate closely with Dr. Borja and Dr. Prince at Mariana's Foot Care Clinic. Their guidance not only enhanced my professional growth, but also facilitated my integration into the local culture, making Guam feel like home in no time. Over the past 5 years, I have dedicated myself to serving the community through my practice at Mariana's Foot Care Clinic. I have developed a deep affection for my work, my dedicated staff, and above all, my patients. When I speak with my friends and colleagues in New York, I proudly share the stories of wonderful relationships I built with my patients here. Living through a global pandemic alongside the resilient people of Guam has further strengthened my commitment to this island, and now I proudly call my home. If confirmed, this appointment would mark a new chapter for me, working alongside other healthcare committee members and advocating for podiatry. With the support and guidance of experienced colleagues and collaboration of new members, I'm committed to contributing my utmost to serve the people of Guam diligently and effectively. Sidzus Maasi.
Sidzus Maasi. Can I ask, who is there a current podiatric representative on the board? Who is that?
No,
There is none.
there hasn't been in quite a few years. The last one was Dr. Melinda Sangling. I believe it was maybe about 5 years ago.
Okay, that's why I was wondering. I can't find any on the list either. Okay, so that makes sense now, I understand. All right, there was a proposal at one time, I can't remember from who, to move the podiatry over to the Guam Board of Medical Examiners. I'm not sure what your positions are on that. I just want to make you aware of that in case that comes up. That might be something you have to deal with, or the podiatrists on Guam have to deal with, and hopefully testify so we can be very clear. However, are you able and willing to meet the demands of this board? This board, because there are 13 or 14 disciplines already, has a lot of work. They do have a number of complaints. I know there are over 10, if I can remember correctly, but I can't remember exactly how many right now, but there are quite a few. So that's part of the work that they're supposed to do is, in addition to the board meetings on their own time, look at these complaints, so they make in their own fields recommendations to the board as to how we're going to further investigate that or prosecute it or do whatever.
Yes.
So you're able to take that time?
Yes.
All right. And do you think you have any conflict, or that there may be any, you're licensing other podiatrists, you're kind of regulating whether other podiatrists are following the rules of their license or here on Guam, and investigating complaints against them. Are you going to be able to do that despite our very small community and our friendships among each other, or even our non-friendships among each other? Are you going to be able to do that fairly?
Yes. Yes.
Okay. I feel like that's the hardest part of serving on these licensing boards is that, the community is really demanding that we are, really reviewing complaints, making sure that malpractice is not happening, or that we take care of that and we stop that in our community right away. So, yeah, that's why we want board members who are very willing to do that, despite the small-knit society we have here. All right. You've heard about the challenges that they're facing today, and are you willing to become as informed as you possibly can? So this is a board where I feel like, well, all boards, a lot of the times they're, we have like directors or paid staff who come in and they tell the board, so, okay, this is your status. But I feel like the best boards are those who are able to know that independently of what they're being told. They are able to look at the figures themselves. They are able to question those things. For example, the finances, and are you able to look at the fees and say, this is just not reasonable for Guam, or this is the maximum we can go on Guam, or we are going to start losing people, right?
Yes.
All right, thank you. All right, are there any other questions, Senator Taitagui?
Just that I'd like to welcome you aboard and thank you for taking the time out of your personal time to sit on this board. As the speaker said, that it is some challenges that are that the board is having right now. Is there anything you can contribute other than just sitting on the board? And because a lot of times I hear that board members will come to a meeting and they didn't do their homework, they didn't study what was up, and they look at other board members that they know do the homework and just go with them, go with the flow. And that's one of the issues I've had with board members, and I wanted to make sure that your commitment deals with that extra time, not just coming to the board,
Right.
but having to do the homework.
Yes. Yes. Just listening to Dr. Miller talking about a couple cases, the difficulties that he was having. Some of the cases I already know, just because I, do meet people from Korean community, the things that are going on with, the borderline of, the troubles that Dr. Miller is going through. So yes, I do pay attention to a lot of these things just outside of podiatry, and yes, I am willing to commit and be part
Right.
of the board member, yes.
Well, I greatly appreciate that because it's more than just showing up at the board.
Yes.
So much personal time is needed to sit on this board to do a good job. And I don't know, I just have a good feeling about you. Don't disappoint me because that's the first time I've ever said that as a senator sitting here that I got a good feeling about you. So I hope you don't disappoint me.
I won't, thank you.
And I appreciate again for you stepping up to the plate. My office, I've always offered this to everyone, especially someone sitting on the board for the first time. Please feel free to contact me if there's anything I can do or assist with you, or if you have any ideas that you want to swing my way that would have to deal with legislation. I'm so open to that. So, and I hope you feel comfortable enough to do that, because I'm really not a bad guy, you know. Even though you hear these stories that I'm real tough, but not when it comes to somebody dedicating their service and personal time to the people of Guam. I have great respect for. So thank you so much.
Thank you, Senator Taitaki.
Thank you, Senator. Senator Kanata.
No questions from me again, Speaker. I just genuinely want to thank you, Mr. Steve Kim, for your service and stepping up to serve the island and the community. Certainly going to take some of your personal time away from your friends and your own personal family, right? So I just want to wish you all the best. And again, I continue to echo my support to you and the board. And if there's anything you need legislatively, my office remains open. Thank you again for your service. Thank you, Madam Speaker.
Thank you, Senator Kanata.
Thank you, Senator. I'm trying to confirm, give me 1 second, when we received your appointment. Looks like February. Okay. So I have no further questions. But before we, okay. Is there anyone else here to testify on this nomination? All right, if not, then Dr. Kim Sidusmasi, thank you for your willingness to serve on this board and for your testimony and being here today. And thank you, Dr. Borja.
Thank you.
All right, we'll now move forward with the nomination of Velma R. Harper. Dr. Velma R. Harper, DVM, was nominated to serve as a member, the Veterinary Medicine Representative to the Guam Board of Allied Health Examiners for a term of 3 years. It says to fill the seat of Dr. Paul Pomes, whose term has expired. Is there anyone here to testify on this nomination? If not, then Dr. Harper, you may proceed.
That helps. Half a day and good morning, Speaker Terlaje and senators on the Committee on Health, Land, Justice, and Culture. Thank you for your invitation to this hearing today on my appointment to serve as the veterinary representative on the Guam Board of Allied Health Examiners. I've had the privilege of serving on the Guam Board of Allied Health Examiners for a number of years previously, and so am familiar with the board and what the board is mandated to do for our community. The board members are tasked with regulating the practice of the members of their individual professions in order to protect the public welfare. This can be a daunting task given the board's resources. Being that I have lived here since 1966, I understand these difficulties all too well and have committed myself and will continue to commit myself to improving the oversight the board provides to the public. It is definitely a work in progress. I arrived in Guam in 1966 with my parents, Victoria Harper. My mother was the superintendent of special education, and my father, William, an elementary school principal. My mother was inducted into the Educators Hall of Fame in 1982. I was brought up in an environment that nurtured respect, commitment, and pride in all aspects of life. I was fortunate to have been awarded a Professional Technical Award Scholarship from the Government of Guam for both my undergraduate and veterinary school education. I will be forever thankful for what Guam has done for myself and my family. I began placing my personal roots here in 1983 when myself and my then husband, Antonio Susuico, opened the Harper Valley Boarding and Quarantine Kennels, which are still functioning today. I opened Harper Veterinary Hospital in 1984, which operated successfully in 2013, at which time I moved off island with my daughter. I continued practicing veterinary medicine until my return. Presently, I am practicing at Harper Valley Veterinary Hospital in Essen. My son, Sevi Siswico, and Jessica Nunez have given me the inspiration and support to end my short-lived retirement and get back in the saddle by acquiring the former Isla Veterinary Hospital. Practicing on the mainland reopened my eyes to the possibility for our pet-owning community. In the 1980s, during my early years of practice, all of the civilian and many of the Army veterinarians came out to participate in monthly meetings to share case studies, discuss local issues, and develop a plan to share in the coverage of after-hour emergency services for pets. We shared our expertise amongst each other to provide the best level of veterinary care possible for our patients. This was also my experience in the mainland. I would like to see this happen again, so that our mandate to provide oversight for veterinary practice is in place to protect the welfare of all pets and people of Guam. In conclusion, I think that I'm a good fit for the Guam Board of Allied Health Examiners by virtue of my broad experience and expertise, and most of all, my desire to offer my services for the betterment of our community and their family pets. Thank you very much for your time and consideration. Sizu'us Ma'asi.
Sizus Masi, Dr. Harper, and appreciate your willingness to serve again on this board. I was not aware that you had served before, so I'm glad to know that. And could you just repeat that recommendation you added at the end, towards the end of your testimony? You said you want to, something that is being done, I think, in another place to be done here.
Well, what I was referencing there is that historically, the local veterinarians would work with many of the Army-dependent veterinarians or even active-duty veterinarians, and we would get together and discuss cases and share in covering after-hour emergencies for, so there's continued service for people. And in the process, of course, we are able to kind of have a handle on each other's practice, the level of care. We would, talk about our strengths and our weaknesses, and those of us who didn't feel comfortable with certain surgical procedures or whatever would refer to the other. So we would really make an effort to provide a more quality-controlled type of care. I know that's different than what the board, my position on the board can do, but I feel that underlying that would be something that would be very beneficial to try to, again, provide the services and so that people can understand what veterinary medicine is, what kind of services we do offer, and hopefully, avoid complaints by dealing with it from the ground.
Thank you. The veterinary part of this Allied Health Board, in particular, in my vague memory, is a contentious, they've had some controversy because of, they've actually taken action, I think, if I remember correctly, against one or at least one veterinarian, and it's caused contention, of course. So I just want to know, are you up for that? Because I feel like for your position on this board, that's going to be part of it.
Yes, and that's a very unfortunate state of affairs. I'm hoping and praying that sentiments have changed. It's been 13 years since I was on the board dealing with that. And, people change, environments change, and so I can only be hopeful that, we can get over that and move forward and make an effort to cooperate with each other and get along. Also, the environment as far as our practice has changed. There's many, many more pet owners. There's the much increased demand for veterinary services. So hopefully that will, mellow things out. I can only be hopeful, but, I am prepared for that possibility.
What was the last part?
I am prepared for the possibility that it could start up.
All right. And you have submitted, for my colleagues, there was a revised statement of financial interest that says there is no financial interest in any business for Dr. Harper, and that's been signed July 19, 2024. So are you not running a business right now yourself?
I'm very blessed to have children who are very committed to both the family and what we do. We work as a team. They're here today. And, we run many, us as a group, as a family, run a number of different animal-related type businesses. And, but what has relieved my stress and brought me out of an early semi-retirement is the fact that I have a devoted support team on my practice level, so that I'm not a one-armed paper hanger like I used to be. And they deal with the clinic and inventory and employee issues, hiring, etc. So I strictly go to work. Like my son said, Mom, all you have to do is go to work.
You're an employee.
So, yes, so I'm an employee, and I've relinquished a lot of control over things because in recognition of the fact that, I do know that I have a committed family to help out, and it's been a blessing for me because now surprisingly, I'm enjoying practicing now a lot more than I did for many years. And so also I feel that I have the time and the desire to work on the board and try to get things going.
Do you believe that more, the rules have to be changed for veterinarians on Guam?
No, I don't think they need to be changed. I think they need to be respected, and I think they need to be followed. And I think, petty challenges to them should be just that. I mean, these are the rules, and this is the law, and, it should be respected.
All right. Thank you. I'm going to open it up to Senator Tiding.
Oh, thank you for that doctor thing. Thank you, Madam Speaker, Madam Chair. And I have to divulge that I have known Velma Harper for, our children grew up together way back since 19 Forgotten. Yes, in 1993, I think. That's when our kids were starting. Yeah, I do remember that year. So I've known her for quite some time. And when I first became a senator in the 30th Guam legislature is when I come to find out about the issues on the Allied Health Board. That's when I really was aware of what their responsibilities are and the challenges. And thankful to Dr. Harper, she was sitting on the board at that time. And, I have to commend you, Dr. Harper, to be here again today, to want to sit on this board. I mean, you received, your family, not just you, but your family received threats, and even damaged property that belonged to you because you were doing your job as a board member. You were not turning a blind eye or closing your eyes to the issue, and it caused a lot of stress to your family. So I commend you for your courage and your family's courage, because I'm sure you had to get together because what you experienced before was a family decision. So I'm glad they're here to support you on something you believe in, because you're truly, truly, a hero to me when it comes to the not turning a blind eye and going after the bad guys. Because I know your love for animals. I've seen your work, hanging out with you for many years, and your love you have for your job, but especially for animals. You know, and when you're seeing other people hurt their family pet, they call family members, you're not going to tolerate that. So you taught me a lot. I mean, going after the bad guys and sticking to my gun because, you know, it's not easy in this position. You're going to bring a wealth of history issues that are continuing to linger on this board. You know, Velma, so I hope, or Dr. Harper, sorry, I'm so used to. I know you speak up and you speak out and you do it very well. So please don't hesitate to do so on this board and pushing for what the board really needs. And right now it sounds to me like Public Health and the Allied Health Board need to really get their numbers together and provide the enforcement. Like you said earlier, it's the enforcement of these laws, to respect these laws that are put in place, these rules and regulations to put in place. So I appreciate you mentioning that. You have my support. I don't always give that out, you know, during a public hearing. And it's not because I've known you, you know, we've been friends for a long time, but because I've seen you do your job. That's why. And I've seen you take the hits because you're doing your job. So I just, I'm glad you've returned to Guam, and you know how to get a hold of me always. You know, we haven't, you know, gotten older, so we haven't seen each other as much as before, but it's good to hear that. I'm just really, really happy that what happened to you is not deterring you from continuing to serve this island. And again, to Sevi and his wife and the family, thank you for allowing her to do this and being her support so that she can. Thank you.
Senator Taitagui. Senator Kanata.
No questions from me, Ms. Speaker. I just wanted to thank you again, Ms. Harper, for your services to the island and the community, most especially to your family. I really wish you all the best on your future journey again. And again, if there's any legislation that needs to be taken care of on my side, my office remains open to supporting you in those initiatives. Again, thank you to your family and yourself for your services to the island and the community.
Thank you, Senator.
Senator Kanata.
And thank you, Senator Taitagui. You almost brought tears to my eyes. I really appreciate your comments today. It makes me feel great. So I want to thank you for that, too.
Thank you. And we have with us now our Vice Chair, Senator Joanne Brown.
Hi, good morning, Madam Speaker, and thank you to Dr. Harper for being here and certainly accepting this appointment. I see on the first round you served, for goodness, 26 years. That's a record. I mean, you and Simon Sanchez probably in government service.
And Greg Miller.
You know, stayed to, you know, to serve that long, and most of this is obviously your volunteer service to the community. Coming back, what would you like to see different or better in your contribution to this particular board? Because, you know, I know Zarantello touched on it, but, you know, we're surprised, but even among the veterinary community, there's just these interesting personalities, shall we say, that for whatever reason end up causing conflict, and the back and forth that goes on sometimes, you got to wonder. You know? So it's sometimes a little contentious in an area most of us wouldn't expect that to be the case, but...
Well, I agree. Your observations are exactly right. And my having gone back to the States to practice for a while, you know, I started to think, oh my gosh, is this how veterinarians treat each other? Is this how our professional community behaves? And going to the States just renewed my confidence in myself, number one, because no, it's not. It should not be that way. And that's why, personally, you know, some of the complaints may come from, well, I don't know about the complaints, but the contentiousness that goes on has just got to stop. And I think that, I'm hopeful that the economic environment has changed. You know, people don't have to feel threatened. You know, other veterinarians don't have to feel threatened, which is really sad, because that undermines that, or that initiates that contentious behavior. And I'm hoping that with time and circumstance that other veterinarians have just mellowed out, just focus. We got enough to do taking care of our pets. And so I'm just hoping that things are a bit different now. I can only hope. And to encourage, rather than having an adversarial kind of relationship between my colleagues and the board, to help, to approach it in a more positive manner, like, what were the issues here? Is there anything we can do to help? Veterinary boards in the States are designed to help the veterinarians. If they have substance abuse problems, they will offer free programs. But there's got to be a professional and respectable communication between the professionals and the board. And that once it becomes contentious, then everybody gets defensive. And so there's no helping, there's no counseling, there's no understanding at all. It just goes away. And that was very sadly what had happened historically among the veterinarians. I, of course, never said much myself because being on the board, I was limited, even though I was being, treated rather unusually. But, that's what my goal is, to just make it a more positive relationship, because we all, including all the veterinarians, chiropractors, all the professionals, should understand that there may be complaints that are justified, but we need to learn how to work through those and determine where each individual can be counseled or helped, rather than approaching it as some sort of criminal offense.
Well, I appreciate your input and, again, your continued service. I think that's such an advantage for you coming back after all these years. And as you mentioned, you had a different perspective going back to the mainland and working there and seeing a different environment. Hopefully you can bring the good parts back to our island, and we hope to see an improvement, because some of the attacks that have gone back and forth among the veterinarians, it just raises a big question mark in your mind as to why that's the case. And we understand there's some interesting personalities out there, but we all have our own personalities, but we still have a job to do, and we should do it as professionally as we can. So I like the comment that you made that we need to follow what the law is and measure it according to that, not so much who the individual is that's involved or whatever that's involved in a specific case, but making sure that they're following the requirements that they need to with regards to the veterinary profession. So certainly good luck to you. I wish you well. Welcome back. And as I mentioned, I think the number of years you've served will be a tremendous advantage in coming back and providing that service. So thank you. Thank you to your family as well.
Thank you very much. I really appreciate it.
Thank you, Senator Brown. And again, Dr. Harper, Sijus Masi, for your willingness to serve again on this board. And I note the many years that you have served on the board now. I was not aware, and so I'm glad to be made aware of that, and that you were there during the time of great controversy. I think all the members of the board have to take note of this, that this is the potential of this board, and I think your recommendations of how to move forward are good. So I'm wishing you the best as well, and thank you again for your willingness to serve.
Thank you, Madam Speaker and Senators. I have no words to say how thankful I am for your kind words. Thank you.
Thank you. We'll now move forward to the appointment of Roselin Tiding Fong, occupational therapist, to serve as a member, occupational therapy representative to the Guam Board of Allied Health Examiners for 3 years. If there's anyone who's here to testify, please come forward. Otherwise, Ms. Tiding Fong, you may proceed. And thank you for waiting for all of the other appointments, but I really wanted them to be together so that you can hear our questions or concerns for each of these fields, because even though you're an occupational therapist, you have to handle all the other fields complaints as well, the finances, all of it. So Sijus Masi again, and we're here for your testimony today.
Thank you, and good morning, Speaker, Senators. I would like to thank you for inviting me to this confirmation hearing. This is my first time to actually be appointed to a board, but it's not my first time to sit together as a group When I became an occupational therapist in 1995, there was a small group of us who decided, at that time, we weren't licensed here to practice. And so because we were concerned that any Tom, Dick, and Harry could come along, but more especially towards the physical therapists, because a lot of their modalities could also be used under the guise of chiropractic or massage. So we decided we needed to get together and come up with rules and regulations and push to become licensed and certified to practice here in Guam. So that happened in 1997. And then in 1999, we formed the Occupational Physical Therapy Association of Guam. And we've had several members from our association on the board. Most recently, Alicia Ogo was the representative for OT, and I believe Ryan Claris is the physical therapy representative at the time. It's hard to speak of occupational therapy alone because OTs and PTs work together. So even though there hasn't been any complaints or many complaints regarding my field of practice here on Guam, we do hear a lot of complaints from the physical therapists here on Guam. So I am aware of some of the things that are going on. And then Dr. Mamie Balahaja, I've not worked with her directly, but I've met with her at many conferences, and she talks about the board and all the issues that come up with the board. So I'm a little bit aware of what's happening at the board. It really is an honor to be asked by my colleagues to sit on this board. I never thought about having to do this, but they really, Sybil Chrysostomo is a speech pathologist, and she is the board member representing that discipline, really, really pushed me to accept the appointment. She goes, "Come on, Roz, I know you can do it. You have a voice. You will speak up." I'm like, okay, I'll do this. And I've been occupational therapist for almost 30 years here. Prior to that, I was a teacher at Simon Sanchez for like 6 years, 4 years teaching at the university, at Texas Women's University while I was pursuing my degree in OT. I was offered jobs while I was there. I mean, really, really nice jobs. But, I told them, I said, there's a reason why I came here, and I need to come back and serve my people. So I've been doing that. I retired from the Department of Education, Special Education, in 2016, but decided I needed to do something more on the other side. So I am now working with individuals with disabilities in a group home for Catholic Social Service. And it's really interesting because some of those particular individuals were my students at one time. So it is nice to see them from the beginning to the end. So I feel that I am willing to serve on this board and to, uphold and make sure that whichever discipline there are complaints of, that we address it and address it properly. Thank you.
Thank you, Ms. Tiding Fong. Very grateful for your service and your service for all these years, really, in your profession. And I like that your colleagues said you are a voice that will speak up, so I'm very encouraged by that. I feel like there can't be enough of that on this board. It's a big board. It's a big responsibility. So thank you for being willing to take on this responsibility. We ask, do you have any interest in any business that might have a conflict with what you're doing or your licensing or anything like that?
No, I do not.
Thank you. And I know that you're continuing to work at Catholic Social Services, and as you said, in a group home. I think that's a very unique experience you have now, seeing them as children in the special ed, and now here.
As adults.
Maybe you should write about it. I'm just thinking like that's probably unique.
I believe these individuals really need. Here on Guam, it's really been a stigma, and I remember Dr. Harper's mother, because she was, at the time, the special ed, for the director for special education services. And I remember hearing about her before I became part of special ed. And, for the longest time, I remember when I was in high school way back when, that we never saw anybody or anyone in the school system with disabilities, right? They were, and I never even knew about this until I actually made a visit to Chief Brody Elementary. And I was shocked because I never knew we had individuals with disabilities here because we never saw them in the school system. So I think this, just got the ball rolling in my area because I actually have a degree in biology, a bachelor's and a master's in it, but my heart always went out to teaching, right? And in my capacity, I'm still teaching, not necessarily our residents, but teaching our staff how to work with those with disabilities and, recognize them as humans. That we're all the same despite disabilities. So, I really feel that we need to remember that, and bring that to the board, and remember that, we have a chance here to make sure that those that we serve get the best care possible. And
how many occupational therapists do you believe there are on Guam?
I know that there's only a handful of us because there's a small group. Now, Kathy was sharing with me, sorry, Mr. Nicolas, I've known her forever, said there was 53, and I said there is not 53 here on Guam. I don't know where you got that number. She said it was on the website, but actually there's only 5 of us here, as far as not in the military, because those who practice OT and PT in the military don't need to be licensed here, because they only work on base. So there's only 5, 2 at Guam Memorial Hospital, 1 at GRMC, myself, sorry, there's 6 of us, Jenny, who works for DODEA, and Wendy, who works for Early Intervention Navy. So there's really only 6 of us, and there's supposed to be another pediatric OT coming here and wanting to work here, so that'll make 7. We've had several certified OT assistants here on Guam. I think we have 1, and she's working at Health Services of the Pacific. But we don't have that many. There are more PTs here than there are OTs, and we're really stretched thin. When I retired from DOE Special Ed, they wanted to hire me right back, and I'm like, no, I really need to move to another venue, and and so I really like where I'm at. I really miss all the kids and everyone I worked with. They're even pulling me to the hospital, which I've never worked in the hospital. Only because I just don't form relationships like I do when I work with families. So they're still trying to convince me to come over. I call that the dark side.
Well, I look forward to your service on this board. Again, please don't, as you said, this is your first time to serve on this board, maybe, but I hope that just brings fresh perspective, fresh questioning, explain this all over again, so that it's understood by you, because if it's understood by you, it would be understood by the public, and it will make sense. And if it doesn't make sense, then please pursue that until it does, and I would appreciate that work on your behalf. And thank you again. So, and Senator Taitagui, any questions?
Thank you, Madam Speaker. Half a day. This is ironic, having so many friends that are sitting on this board that I know, and greatly appreciate them, and getting to knowing them personally makes it easier for my vote, because I've known you since 19 Forgotten as well.
19 Forgotten, yes, at GW.
Biba GW. And I'm just so proud of your accomplishments. 30 years doing what you're doing, and very vocal. Yes, of course, we came from GW. I think that's where we learned it from, to be vocal.
Yes.
And and I feel comfortable you're going to do very well, especially with Kathy there, another GW 79er there who's going to help you along the way because she's been sitting on this board for quite a while and doing the finance. I greatly appreciate. You have to really get a hold of her spreadsheet that she just provided us to look at that. It's great information to have. I really don't have anything other than I'm just really so happy that we're getting more people who I know are strong women who are coming forward to sit on this board that has been in need of adjustment, in need of assistance, and in need of advocacy to push your agenda as well as keep our island safe. And that's the whole purpose why you're there. So thank you. Thank you so much.
Thank you.
Because I know you could be traveling out there and having a good time. But and I know, Madam Speaker, that from her background that she doesn't do anything just halfway through. It's all the way or nothing. And I know that she's invested this appointment into herself. So we're going to see a lot of great changes at the Ally Health Bill with her on this board. So greatly appreciate it, and I support your nomination.
Thank you for those words, Senator.
You're very welcome. Thank you, Madam Speaker.
Thank you, Senator Tiding Fong. Vice Chair, Senator Brown.
Thank you, Madam. Good morning to you, Ms. Tiding Fong. I've not known you as Senator Tello has, but I certainly would take heed to her recommendation. I have to tell you, your testimony is refreshing. We get a lot of people here that are nominated for different boards and commissions, and it's a routine kind of thing, but I appreciate you providing your background and your interest of why you do what you do. And coming back to Guam and investing here, because all we hear lately is it's about the money. Everything's about the money. We can't keep people because they get better job offers and better opportunities, and certainly, I think all of us can understand that, but to a certain degree, if you love Guam and you love your home and your families here, you want to invest in a better community. And,
I agree.
There's no price tag on that. That's essentially something that you have to have, and I appreciate you relaying that. But can you enlighten me and our listeners out there? I get a general idea of what you might do as an occupational therapist and how few of you are here on island, but if I can ask, sorry, my voice is kind of going this morning, but can you relay what exactly is your expertise and what do you do as an occupational therapist so that we can be a little more enlightened for those of us that are not as aware?
Yeah. Well, everyone knows physical therapy, right? And so they always ask, what is an occupational therapist? And they always ask, so do you help us get jobs? So I always have to tell them no, but what we do is we assist persons through purposeful, meaningful activities to participate in daily living skills. So that could be whatever your occupation is at that time, which hence the word occupational therapy. So if you're working and you had a work-related injury, then of course, it depends. If it's just, let's say, it's a cliche, but if it's your hand, that's what occupational therapists do, right? You don't normally refer to a physical therapist. If you've had a stroke and you can't get back to what you were doing prior to the stroke, then they refer to OTs because the occupational therapist will then help you to modify your environment or how you do certain things like washing dishes or cooking at the stove or even getting back to work. So we do a lot of problem solving. We look at what you have, and then from there, we come up with the goals and objectives, and we really have to listen to our patients, our family members, right, what they want, and try to accomplish that particular goal to get back to where they were prior to their injury. So PTs do that, but more so physical therapists work on mobility, balance, strength, and then we take it a bit further and look at the functionality of all of that. So that's what occupational therapists do.
I see. Well, there's no doubt quite a demand, I'm sure, for the type of services you provide, from just the range you're talking about working with disabled children all the way up to those that are elderly, or like you said, you could have had a stroke or an accident that impacted you, and it just getting back probably just to the routine process of life or living, I guess, would be a good way of summing up. And in your position here on the board, I appreciate you being vocal. We don't have enough of that. As Senator Tello mentioned, a lot of people look away and they don't want to get involved, which surprises me because I'm going, this is our community, and if things are happening bad, there's going to be repercussions that are not going to be good to our family, our friends that live here. But yet when when the time comes to stand up and be counted, people are hiding under the desk. And that's the actual reality, the sad reality when you get right down to it. So, I mean, in your desire, and I appreciate that in coming forth, because it sounds like you have a very busy, demanding profession already.
Yes, but
what do you hope to see with your role on the board, and not just your contribution from a professional side, but just in terms of essentially the role of the board really to regulate these professions, these very critical professions that have a lot to do with our physical health and well-being?
I really want to make sure that we do have, I mean, it's been going on for years that there are persons out there that state that they are able to do all these different modalities, right? And they're not actually licensed or certified or trained to do so. And we really need to make sure that this practice has to stop. People will get hurt, and just like Dr. Miller had mentioned earlier, right? Then of course the chiropractors get a bad name because, of course, whatever it is they're doing, they're quoting it's a chiropractic practice. It's the same thing for OT and the same thing for PT, and I'm sure for all the other disciplines under the Allied Health Board. So we really need to, we've talked about the cases and where it's kind of stagnant, that we really need to push it forward so that those who are out there in the community know that, we mean business. This is not just a slap on the wrist or, turn the blind eye, that we really need to really put a stop to a lot of these people who are practicing when those modalities or specific techniques that they shouldn't be doing, because you can get hurt if you're not trained properly and you're not licensed or certified to do it.
Well, and I appreciate your feedback with regards to that, because people in the community may not know. They don't know the credentials. Someone could put a shingle up and say, this is who I am and what I do, and then beyond that, they don't know. They're relying on the good faith of that individual, that they have the skill sets and expertise and credentials to do that. But as you're mentioning, I hear that in certain practices here on island, even among the professionals that are aware of those that are practicing that don't have credentials.
Right.
And they're concerned about that because it gives that particular field a bad name in some ways as well. So I'm glad to hear that. I mean, it seems like it shouldn't be that complicated to do the right thing and follow the rules.
But it is,
but
it is hard.
But for a lot out there, it's like, they make their own as they go along, and we're just supposed to put up with it, or they can bully their way around. And, some people get intimidated by that, and then they're just not held accountable or responsible for their actions. So, I mean, the community is definitely relying on the work that you do on the board to hold those responsible and ensure that those that are providing, particularly in the healthcare profession, that they're doing what they need to do to help the community and not harm the community. So I certainly appreciate your response to these questions. I wish you well. We look forward to hearing more positive things with this particular board, because it doesn't always have that reputation, and being, responsible and doing things in a timely manner, because sometimes some of these cases have lingered, or when they tell us, oh, we lost the case documents, we're like, what? What happened? And what have you done about it? And what have you done to correct it? Those are the next questions we ask. But we're not here as a policy-making body we can't manage commissions and boards and departments. And while we realize there's a lot of frustration in the community with how these things are going, we only can, from a policy standpoint, hopefully, like in this case, confirm individuals like you that can go and do the right thing and do what you need to do, and take the responsibility and authority of this board and properly invest it on where it needs to be, because we certainly want to see better things out of the board that you're serving on, because there's a need for it. And ultimately, our people should have some confidence that when they do receive these type of health support from these professions, that they're getting the best service possible from responsible individuals that have the capability and credentials to perform the work. So we wish you well, and thank you for accepting the nomination. I think, as I mentioned, your testimony here has been rather refreshing this morning.
Thank you, Senator.
Thank you very much, Madam Speaker.
Senator Brown. And again, Ms. Tiding Fong, Masi, for your willingness to serve on this and this board, and we wish you the best in that service. I just wanted to, earlier we talked about governing massage, and it's not under this board at this time. This board is authorized, though, to add other disciplines if on its recommendation, right? But massage is currently governed by Department of Public Health and Social Services sanitary and health permits, so there are rules and regs for them in particular. I just wanted to put that on the record so that those listening earlier, that's what I could find was that massage is governed by rules under the sanitary permitting laws. So there being no further testimony, I'm going to call the reappointments of Dr. Gregory J. Miller and Katherine Nicholas, and the appointments of Sungwook Steve S. Kim and Velma R. Harper and Roselin Tiding Fong, all duly heard by this committee. And this public hearing is now adjourned, and the time is 11 a.m.
Thank you, Senators. Have a great day.
Thank you.